On Radio, the talk show podcast station, bringing you daily health and information, where daily health is viewed as an ever-changing reality. Thank you for taking the time to tune in. This is Daily Health. Now, all information and resources are based on the opinions of the host, unless otherwise noted. All information is intended to motivate, encourage, and inspire positive change and a healthier lifestyle. This podcast contains some quotations, images, and/or excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. Welcome everyone. You are listening to On Radio, the talk show podcast station, bringing you daily health. And today we will be talking about the rising cost of insulin. Now, there's a lot of diabetics across the world who have to come out of pocket to pay for insulin, and there are a lot of people who have insurance, but the copays are too high, the caps. I mean, it's so much going on with that people are actually dying from the lack of having the resources to be able to purchase insulin. Now, diabetes is nothing to play with, and so many people have it that, I mean, it's almost like it's big business. Now, spurred by stories that diabetics are spending thousands of dollars a year on insulin or even dying trying to ration it. It's so bad that lawmakers in at least 36 states are trying to tackle the issue. So it's getting pretty serious, and this is definitely something that affects the health. And here at Daily Health, I want everyone to be as healthy and live as healthy and long as possible. Now, Tennessee State Rep. Jason Hodges wanted to do something about the soaring cost of insulin. He learned that in the United States, the average list price for insulin tripled from 2002 to 2013, and then doubled from 2012 to 2016, forcing some diabetics to spend as much as $1,200 a month. That is a lot of money. So he wrote a bill to forbid any pharmacy in Tennessee from charging more than $100 for a 30-day insulin supply, thinking that would force drug companies to lower their prices. As Hodges, a Democrat, prepared in March to file his bill, he was approached by a lobbyist for Eli Lilly and Company, one of the three multinational drug companies that make insulin for U.S. patients. Now, the lobbyist handed him an amendment. Hodges told Fair Warning and said one of his co-sponsors had already signed off on the changes. Now, he went on to say, "I'm the sponsor of the dang bill. I haven't agreed to anything." Hodges remembers responding, Eli Lilly proposal also would have capped monthly cost of insulin at $100, but only for diabetics with health insurance. It offered nothing for uninsured, knowing that many of the people struggling to afford insulin in Tennessee are uninsured, especially right now during this pandemic. That's even worse. Now, Hodges rejected the changes. He said the lobbyist Etsy Harris warned that Eli Lilly would fight the bill unless he reconsidered. Harris did not respond to messages from Fair Warning. Now, insulin, which was invented 100 years ago and cost less than $10 a vial to produce, according to one study, has become a symbol of the federal government's failure to control the cost of prescription drugs. As diabetics became an epidemic in the United States, researchers found that manufacturers Eli Lilly, Sanofi, and Novo Nordisk drastically increased the list price of their medications. Eli Lilly's popular Humalog injections are now listed at $275 a vial for American consumers. In Canada, that same vial goes for $32. This is insane. People have to live. The three drug manufacturers have justified the price hikes by saying that their profits from insulin have not increased after accounting for inflation, the cost of research, and negotiations with health insurers and pharmacists. Now, people, especially diabetic, they need this medication. It should not break the bank to buy your medication. You should not have to do that. It is for your health. And hopefully something really will be done about this. Now, according to interviews with lawmakers in 9 states, often the only way to pass an insulin price cap is to write it in a way that pushes the cost onto insurers. Lawmakers in 2 states, Tennessee and Minnesota, said their proposals faced pushback from pharmaceutical industry lobbyists when they tried to reduce the price for all patients, not just those with insurance. Lawmakers in several other states stated that the pharmaceutical lobbyists were neutral or even helpful when they proposed controlling insulin costs through insurance copays. It's kind of hard to believe, though. It really is kind of hard to believe. Health is a big thing, and insulin is needed by diabetics. So I really think that these pharmaceutical companies are basically trying to get rich off your health needs, and it's not cool. It's not fair. Some lawmakers said they decided on copay caps because they knew from having gone against the pharmaceutical lobby in the past that otherwise their bills would fail. Now, a lawmaker in West Virginia stated that a report commissioned by Eli Lilly stated that copay caps were the best way to reduce insulin costs, helped sell her on the idea. Last year, West Virginia lawmakers organized a bus trip to Canada to help constituents buy affordable insulin. In March, the state passed a $100 copay cap. Now, this is forcing insurers to share more of the cost of insulin, as the Eli Lilly lobbyist in Tennessee had allegedly proposed. Now, this will certainly help some diabetics, but many also help drug companies. Lowering copays or the amount an insured patient spends out of pocket doesn't force drug makers to put a lower price on life-saving drugs or hold drug makers responsible for their role in rising healthcare costs. Now, that is just sad. In a statement, Eli Lilly spokesman Bradley Jacklin said the company believes in the common goal of ensuring affordable access to insulin and that it's possible to achieve this through rebates, discount programs, and increasing awareness of government programs that subsidize insulin. So for everyone who doesn't know, there are discount programs and government programs that subsidize insulin. So check those out if you're a diabetic, or if you know someone who's a diabetic, your friend, your family, your mom, your dad, your uncle, whoever, friend, co-worker, it doesn't matter. Let them know. Now, in Tennessee, Hodges secured enough votes for his bill to set a $100 price ceiling, not a copay, and its first reading. But in June, he decided to pull the bill after colleagues whose support he counted on told him they will no longer vote for it. I refused to change the bill, and so at that point, pharmaceutical companies were very opposed to it, he said. Now, there's a huge problem with the copay caps, because you have so many seniors out there and so many youth out there who are diabetic who cannot pay out of pocket like that. Even when they do have insurance, it's still hard because anything they pay, that's pretty much causing a hardship on that person because they still have bills, They still have to eat. I mean, they still have to live. But of course, these companies are not taking that into consideration. Now, like I said, the problem with copay caps. Unlike Hodges, Oregon State Rep Sherry Shelton, a Democrat, got buy-in from the drug industry when she wrote a bill to lower what diabetics would pay for insulin. Rather than put a cap on the price, her bill would have imposed a $75 limit on insurance copays. Now, she expected it to pass before COVID-19 brought work into the legislature to a halt. COVID-19 is screwing with everything. Now, if the pharmaceutical industry is going to come after you, nothing's going to happen, she said in the interview. So that's the reason I went through the insurance route. Some advocates say that copay caps don't address the root of the problem, high insulin prices, which I can see and understand that. Besides doing nothing for the uninsured, copay caps only help people with private insurance. Now, people on federal health plans like Medicare won't benefit because states can't regulate prices set by federal plans. See, that's the catch-22 on that one. And you guys need to know that. Now, I'm always messing up people's names. Please forgive me. Harry Rabolt is an example of a type 1 diabetes patient who will be left out under a state copay cap. Now, Harry, 68, a social worker in Indiana, expects that his insulin will cost him $350 a month under Medicare Part D. He started speaking out against the high drug prices when his son, Jeremy Crawford, died at 39 from complications of the disease last year. The family realized he had likely been going without his normal insulin prescription while waiting for the health insurance at a new job to kick in. This is what I mean. We are losing people. It is affecting, these insulin costs are affecting people's health severely. It's causing death. People cannot afford it. Now, Harry stated all he had to do was call me. Well, some people want to do things on their own and manage without asking for help, and that's a tough situation to be in. It really is. You don't want to ask for help, your pride and everything else. You don't want to be a bother, whatever the case may be that you might be feeling, but please speak out and ask for help so you don't get lost in the crowd and pass away from complications of diabetes because of a lack of insulin. Now, T1 International, a diabetes advocacy group that has pushed state and federal lawmakers to regulate the price of insulin, says that copay caps are better than nothing, but should not be the ultimate goal. According to the group's research, about a quarter of type 1 diabetics in the U.S. ration their insulin to save money, and at least 5 people in the U.S. died from insulin rationing in 2019. One of the reasons that pharma is not challenging these bills is because these copay caps aren't pushing pharma at all. Now, TI International Advocacy Manager Allison Bailey stated, and because the copay caps push the price onto insurers, I think it's within reason to expect that at some point it might affect the premiums of other individuals. I mean, it's just entangling pretty much everybody. Now, lawmakers proposing copay caps only have to contend with the health insurance lobby, which has testified against such bills, and work to weaken one that had already passed in Colorado. In May of 2019, Colorado became the first state to cap insulin copays for diabetics with private insurance. The situation had become so dire that we needed to pass something right away that would have an immediate impact on the price of insulin, stated by State Rep Dylan Roberts, a Democrat And the bill author said in an interview the law was supposed to set a $100 copay limit on a diabetic's entire monthly insulin prescription. But after the bill was signed into law, the insurance industry convinced Colorado regulators that the cap should apply to each brand of insulin, even though some diabetics rely on multiple brands in a month. Now, the Colorado legislature hoped to close the loophole before COVID-19, but it did not happen, unfortunately. So they're still struggling. 9 other states, Illinois, Maine, New Hampshire, New Mexico, New York, Utah, Virginia, Washington, and West Virginia, got similar copay limits signed into law. In Utah, the copay that passed in April will also benefit the uninsured through a state-funded program that provides a 60% discount. So for those diabetics in the states that I just listed, there is some help there for you. Now, the manufacturers weren't excited about it, but they said, hey, we're a whole lot more okay with what you're doing than what we're... Pardon me. You're doing than what they're doing in other states. Now, Utah State Rep. Norm Thurston, a Republican, said in an interview, and I was like, okay, that tells me maybe I need to push harder. And they said, nope, you're doing fine. So we've got all this lobbying and then lawsuits, and well, lawsuits come after so long of battling and fighting. This is a big issue, but people need their insulin. I mean, they're facing off against industry lobbyists at legislative hearings. You got volunteer advocates sharing their personal stories. They're trying to get it out there. They're trying to get some help. So hopefully they do, because we have lost so many people behind not having enough insulin, not having enough insurance to cover, not having the full copay. It can be really tough, and it could be hard. It's not fair, but it is what it is. But there are people out there working on it, working for you. If you're diabetic, this is for you. Lobbyists and everybody else, legislation, advocates, they're all working to try to help you. Now, PhRMA, the leading drug industry group, argued that the industry was already taking voluntary steps to help diabetics, including supporting rebate and discount programs and advocating for insurers to limit copays. Now, in 2019, Novo Nordisk, which hadn't done any lobbying in Minnesota the year before, spent $120,000, and that's what the state record shows. PhRMA spent $430,000 on lobbying in 2019. Now, state records show about double the usual amount, but disclosure statements don't indicate how much was spent to fight the insulin bill. Now, if they're spending, one is spending $120,000, the other is spending $430,000. Can you imagine just how much they're spending to fight the insulin bill, which people need? Now, reached by telephone, a lobbyist hired by Novo Nordisk that year declined to comment, of course. Novo Nordisk spokesman Ken said, our engagement in Minnesota was to ensure stakeholders were educated on how our existing national insulin affordability programs are robust. Yeah, okay. Ultimately, the Alex Smith Insulin Affordability Act, signed into law in April, requires Minnesota pharmacists to provide insulin at a steep discount to the uninsured and others who qualify. The law requires drug companies to provide free insulin to pharmacists who offer the discount. But just hours before Alex's law was to go into effect on July 1st, Pharma sued, claiming the law amounted to an unconstitutional taking of private property. The Minnesota law will order pharmaceutical manufacturers to give insulin to state residents on the state's prescribed terms. The suit argues at no charge to the recipients and without compensating the manufacturers in any way. See, I knew they were going to feel some type of way about that because they don't want to give anything. Humanity is something that is important. Life is important. But for these major companies and corporations, the money is what's important to them, not your health. And it's not right by any means. So look for any discounts that you can. Coupons, go on the internet. There is so much information out there. Research and find out, because there are some benefits out there. And if you want to dig deep into what's going on with it, if you're diabetic, wherever you live, go online and look up your state on the government site and see what the costs are, see what they're doing, and see what programs they have to assist you in getting your insulin, because diabetics need to have their insulin. So take care of yourselves, eat right, walk, get your exercise. A few crunches here, a few sit-ups here. If you're physically unable, there's always something else you can do. So take care of yourselves, and hopefully they will resolve this. I call it price gouging, to be honest. But it's the rising cost of insulin. It's a monopoly. And the pharmaceutical companies have pretty much all the chips. They have all the properties, and so every square you land on for insulin, you gotta pay. But one day, it will not be that way. So all you diabetics out there, keep holding on, keep eating right. Do your research. There are some things you can do. You can even try organic alternatives. There's so much information out there. Could even consult with a social worker at the hospital you go to, or talk to a nurse at whatever clinic you go to. But ask questions. That is the best thing that you can do for your health, is ask questions and see what can be done. So until next time, take care of yourselves and be blessed. You have been listening to On One Radio, the talk show podcast. This has been Let's Talk Daily Health, where daily health is viewed as an ever-changing reality. If you would like to get in contact with On One Radio, the email is onOneRadioTalk@gmail.com. Place it to the attention of Daily Health. I have been your host, Tony Williams, and thank you for listening. For more, you can find me on YouTube. The name is Tony On One. You can find On One Radio on Facebook, On One's Day One's private Facebook group, WordPress, Twitter, Instagram, Tumblr. On One Radio's out there. And I